Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for parents who are expecting. So this is a top 10 list of tips for the prenatal period before your child is born. Tip number 1, there are many great things you can do to help promote the health of your baby during pregnancy, and you should speak to your obstetrician about the specifics. 2 recommendations I'll recommend for you in our first tip are getting a prenatal multivitamin if you are a pregnant woman, and getting the influenza vaccine if it's flu season. These are 2 really helpful and effective ways to promote the health of your baby. Tip number 2, plan to breastfeed. Breastfeeding is the optimal nutrition for the first 6 months of your child's life. And there are great benefits for both you and the baby if you do breastfeed, including a quicker return for you to your pre-pregnancy weight, bonding with your infant, increasing the IQ of your child, decreasing the risk of infections and hospitalizations during the first year of life. So breastfeeding is a great thing to plan on doing, and I recommend taking a class in how to breastfeed before you actually deliver. Ask your doctor about classes near you. You can also ask your doctor about a prescription for a breastfeeding pump if you plan on breastfeeding but are concerned about going back to work after your child is born. Tip number 3, prepare your home and your car to be tobacco free. So make sure that if you or anyone in your family smokes, that they quit. For you, if you're pregnant before you even get pregnant, and for anyone in the house, including you, make sure that no one smokes in the house or car. And even if people smoke outside, when they come in, they'll have the smoke on their clothes. So even if they smoke outside, it can still affect the baby. So everyone who plans to be around the baby should plan on quitting smoking before the baby's born. Ask your doctor about effective ways to help you quit smoking. Tobacco exposure for babies increases their risk of sudden infant death syndrome, as well as asthma and ear and respiratory infections. So it's a really good idea to remove smoke exposure from your child's world. Tip number 4, make sure that your home is installed with smoke detectors and carbon monoxide detectors with working batteries on every floor of your house. Tip number 5, check the temperature of your hot water in your house, and make sure that it's no more than 120 degrees Fahrenheit. If it is over 120 degrees Fahrenheit, then lower your water heater's temperature. This will prevent your baby from being burned. Tip number 6, buy a crib and keep it in your room, in the parent's bedroom. This is the best place for the crib. Make sure that the crib has slats that are no further than 2 3/8 of an inch apart from each other. Tip number 7, purchase a rectal thermometer. A rectal temperature is the best way to take your child's temperature. And if your child has a temperature that's over 100.4, then you should call your doctor. Tip number 8, make sure that your car is equipped with a car seat that's in the rear and that's facing backwards. And tip number 9, I recommend that parents and caregivers of infants take a CPR course, which can be helpful in the case of emergencies. And tip number 10, believe in yourself. Expecting is a great time to be alive, and I hope these tips are helpful. Thank you very much for listening, and have a great day.